Achilles Tendon and Afulocin Perfloxacin. Afulocin is a fluoroquinolone antibiotic used to treat a number of bacterial infections. It can cause a number of side effects, including tendonitis, especially in the Achilles tendon heel tendon, and this risk may be increased in older adults. Precautions when using Afulocin. Older adults, as tendons in older adults are often weaker and more prone to injury, the use of Afulocin in this group should be exercised with caution. History of tendonitis. Individuals with a history of tendonitis, especially Achilles tendonitis, should avoid using Afulocin. Precautions when using Afulocin. Long-term corticosteroid treatment. Corticosteroids can weaken tendons, so the use of Afulocin concurrently with corticosteroids should be carefully considered. Precautions when using Afulocin. Strenuous exercise. Individuals engaging in strenuous exercise have a higher risk of tendonitis, so strenuous physical activity should be limited while taking Afulocin. Preventive measures for tendonitis. Check your heel immediately upon starting treatment with Afulocin. Patients should be checked for any pain or swelling in their heel. If present, this should be reported to a doctor immediately. Preventive measures for tendonitis. Stop medication if any pain or swelling develops in the Achilles tendon. Afulocin use should be stopped and a doctor consulted immediately. Other considerations. Severe liver impairment. Afulocin should be used with caution in patients with severe liver impairment, as the drug may accumulate in the body and cause adverse effects. Myasthenia gravis. Afulocin may worsen myasthenia gravis, so caution is advised when using it in this patient group. Other considerations. Seizures. Afulocin should be used with caution in patients with a history of seizures or risk factors for seizures. Other considerations. Drug resistance. Drug resistance or resistance screening may occur, especially with prolonged treatment with Afulocin. This could lead to an increased risk of hospital-acquired infections caused by strains of Staphylococci and Pseudomonas. Contraindications for Afulocin. Hypersensitivity. Patients hypersensitive to perfloxacin and other components of the drug. History of tendonitis. Patients with a history of tendonitis when using fluoroquinolone antibiotics. Anemia. Afulocin can cause anemia, so it is contraindicated in patients with a history of anemia. Contraindications for Afulocin. Note this information is for general knowledge only and is not a substitute for medical advice. Please consult a doctor or pharmacist for accurate advice on the appropriate use of Afulocin for your health condition.